This evening we're going to do a little operation on your knee, which we talked about previously when we met in the clinic.
Liz Coveney is about to have a quite remarkable surgical procedure. At the Spire Hospital in Southampton, her orthopaedic surgeon, Mr. Phil Chapman-Sheath, will be implanting the first and only European-approved advanced therapy medicinal product into her knee to repair a cartilage lesion.
I've had really painful knees for a number of years. I've had a series of operations to correct the procedures. My mobility is decreasing, my activity is decreasing. I have significant problems with stairs. So as a result, I've got a very good opportunity today to actually have this new procedure, which will hopefully correct these issues and make me more active.
The surgery is a groundbreaking technique called characterized chondrocyte implantation using ChondroSelect. Phil Chapman-Sheath was the first surgeon in the UK to treat private patients with CCI after its market authorization as an ATMP.
What makes this revolutionary is that for the first time we can use regenerative medicine in day-to-day orthopaedics. I'm using the cells harvested from the patient's knee to re-implant in the knee, and for this time not in a clinical trial, since the European legislation has now allowed us to use CCI and ChondroSelect.
9 weeks ago, Liz had a cartilage biopsy taken from the non-weight-bearing part of her articular cartilage using the ChondroSelect harvester. This small amount of cartilage was then taken to the Tygenic cell expansion facility in Belgium, where the chondrocytes were extracted and then expanded and cultured to create the medicinal product ChondroSelect.
With ChondroSelect we can actually work with Liz and Phil Chapman-Sheath to plan it for when it's convenient to them, but with procedures we were beholden to when the cells were ready, so we weren't able to plan at all.
Liz undergoes a general anaesthetic prior to a mini arthrotomy being performed on her knee in order to facilitate the implantation of the ChondroSelect. An area of damage on the articular cartilage on the end of her thigh bone is exposed and prepared by creating well-defined sharp edges to the lesion and removing any remaining cartilage from the bony surface. The surgeon uses an aluminium foil template to determine the perfect shape to cut the collagen membrane to the size of the defect, prior to taking the ChondroSelect from his nurse assistant and seeding it onto the back of the membrane. It's now ready for implantation. Securing the membrane with the ChondroSelect beneath is the final piece of the jigsaw. The procedure takes less than 1 hour, prior to the patient's knee being closed and the start of the semi-personalized physiotherapy and rehabilitation that'll allow the ChondroSelect to regenerate the cartilage. Liz now has the potential to return to a fully active life by delaying the onset of osteoarthritis.
Liz will recuperate at the Spire Southampton Hospital over the next few days, starting her physiotherapy and her rehabilitation. And that will continue for the next 12 months while the ChondroSelect turns into healthy articular cartilage. And I think she's taken the first step in her fight to resist arthritis and prevent knee replacement using a large metal prosthesis, and hopefully give her a full active life.
Regenerative medicine has for a long time been championed as the hallowed future of healthcare delivery. It's a future in which perhaps we could regrow our failing body parts to live longer and be more active in later life. What was once considered science fiction is now reality, at least for articular cartilage damage in the knee.